So the first thing you want to do is take the medication out of the refrigerator and let it sit in room temperature for about 30 minutes. And this will allow it to warm up, and the
No.
medication is much less painful to be injected in room temperature versus cold. Now Dupixent comes in 2 syringes, so we're going to take one out and put the other one back in the fridge. So you're going to want to get everything ready. You're going to need 1 ice cube, an alcohol pad, the now warmed up syringe, and a towel just to keep things dry. So the first step is to put the ice cube in the place you want it to be injected. Now you can inject it into your leg or your side, but I find the leg to be way less painful. So just press the ice cube there and let it sit for about 5 to 10 minutes. Now I'm just gonna stop the video here and pretend 5 minutes has passed by. So it's been 5 minutes and now the injection site is fairly numb. This is where you use the towel to clean off any of the water that has melted from the ice cube. Now the procedure from here is pretty normal to how you would do a normal injection, and you just clean off the injection site with an alcohol swab. And you want to check the expiration date on the medication, and they tell you to also check for clarity, so I do that, take off the lid, and give the injection site a pinch, and I find that pinching it distracts the nerves a little bit, and so it's easier to just slowly um, push the needle into yourself without feeling too much pain. Now I do it really slowly here. Sometimes if I pick a good site, it's really easy to get it in, but sometimes um, I don't know why, but some places are harder to get in than others. Now that you're starting the injection, this is where I really think having the pre-filled syringe is way better than having the auto injection pen, because you can really control the flow of the medication. Now, I take a little over a minute to inject all of it, and I think just going slow itself makes the process way less painful. And as you're going, pushing the medication into yourself, I tend to let the pinch go a little bit, um, and that creates the room for the medication to go in, because after the injection, there's going to be sort of a bulb of medication under your skin, and it needs room to expand, and so the pinching gets lighter and lighter as I go. As you approach the end of the syringe, the preloaded spring will pull the needle out of you as you hit the tabs at the end. And if you do it right, sometimes there's not even blood at the injection site, so that's really nice. And I don't even use a band-aid sometimes. And that's it, and then you're done. You just clean up